Hey guys, this is Jackie. I have uploaded a video, which is this one you're watching, on individualized assessment. This is going to be found in your BDS module, so I hope that you guys find it helpful. I've kind of picked apart the most important thing. In our assessments, we use behavioral assessments, and this is going to be a type of assessment that is going to look at indirect and direct procedures, interviews, checklists, and tests to identify and define that specific target behavior. So why do we assess clients? So like I said, we conduct behavioral assessments to determine that baseline, right? We want to know whether we need an intervention if that's necessary. We also want to know what's in the client's repertoire of skills. What do they know, what they don't know? And then third, also, that level of responding before we implement intervention. So getting that baseline is super important. So there are several assessments, right? The link below shows you how do I choose a ABA assessment. And so that's there for you guys. There's lots of information. I've picked 3 assessments. These are behavior analytic language assessment tools. Now they are going to assess language, but also other skills as well. The first assessment is called ABLES, and as you see, it stands for Assessment of Basic Language and Learning Revised Skills. And so this is kind of what that looks like, recording data. You can see down below, it focuses on several skills, interverbal, imitation, there's several there. This is going to be specifically appropriate for young children, ages 2 through 6. Also children's, who might have delays such as 7 and 8. The second assessment, this is commonly used in ABA, it's called the VB map. This is based upon criterion reference, assessing language and social skills, but also some academic skills as well. As you can see, level 1 all the way to level 3. We see in level 1, there's manding, tacting, there is social skills, and then if you look at level 3, we see more of that academic as well as what I had previously mentioned. So this is appropriate for children, young children, ages 2 through 6, who may exhibit delays or primarily in those language and social skills. Then lastly, we have PEAK. This is going to be assessing for, just like I mentioned with ABLES and VB MAP, but this is going to be appropriate for children from birth to 16 years, and it can also be used for adults. So that is a pretty cool thing. This is going to be more than likely a better choice for children who have already moved through that acquisition phases of those assessments I previously mentioned. So for you guys, RBTs, you can assist with BCBAs in conducting assessments like I mentioned, or other assessments that they may have they might want to conduct. So what you are able to do is you can gather that and prepare all those materials for whatever assessment you're conducting. Secondly, you can observe your client, you can record data. And lastly, you can also perform that type of assessment, asking the client to perform that academic task. Now, one thing that you're not able to do is review assessment results with caregivers. That's left up to the BCBA to do, especially with confidentiality. That's one important thing. And I know that even though you are, conducting that assessment, reviewing those results with caregivers is solely left up to the BCBA. So kind of just going and breaking down the different skills you can assess is looking and observing at those client behaviors. And so what you can do is present that SD. Let's say you are assessing a client's ability to mand, and manding being requesting an item. You're going to record the mands and the requests that that client is able to do independently. Second, when you are assessing for social skills, you can count the number of times, in a frequency count on when a client is going to initiate independently play with their peers. Then lastly, tacting is labeling things. So with this one, you can show the client an item, present the SD, and ask that client to name it. So in this video, it shows a quick example of a therapist. In this instance, it is a mom who is performing the VB map, and one of the skills that she is focusing and assessing on is tacting and labeling. So I'm going to show you an example of that just so you can get a better understanding of what I'm talking about. And this video is linked below in case you want to watch it further. So she's going to present the SD, which is, what's this, showing her, the client, a picture. As you see, the client responded with a correct response, and that's recorded. Now, if the client doesn't respond, you still need to take note of that depending on what you're recording on and what assessment you are taking. So yeah, that is the video. Ask any questions that you have in the comments below, and I hope you guys found this helpful. Thank you.